Hello and welcome to the Quadram Institute training course on knowledge exchange with a focus on public engagement. This module is an introduction to the subject and is intended to illustrate how you can benefit from thinking about knowledge exchange and to help you get started. I'm Rebecca Thompson, the Impact Manager at the Quadram Institute Bioscience, and I'll be leading you through the course today. So what are we going to cover today? We're going to start by defining exactly what knowledge exchange is and why we do it. We will then look at how to choose who to involve, how to do it using various different methods, how to plan your strategy to get the most out of it with the minimum effort, how to illustrate the value of your activity, and then finally I'm going to show you some real-life case studies. What is knowledge exchange? Knowledge exchange is sharing knowledge, ideas, experience, evidence, or expertise with non-academic audiences. For example, as partners, participants, collaborators, co-producers, or as end users. It should be mutually beneficial, and it isn't just about telling people things. Knowledge exchange can take place at any time during a research process, and it can take place anywhere with any number of persons being involved. So why do we conduct knowledge exchange? We do it to improve the quality and validity of our research, as well as to create routes for innovation. We also do it to make sure that the research is useful to and used by those who could most benefit from it. You may not have the experience yet to be a knowledge exchange champion, these activities have the potential to benefit you, your collaborators, and your stakeholders. Apart from the fact that most funders require it, knowledge exchange can also improve trust, accountability, your reputation, and allow access to those who could really use it. These are all quotes from researchers talking about how they have benefited from knowledge exchange and public engagement, whether it improved their research, their own career development, or how it inspired them. Our primary funder, UK Research and Innovation, would like us to engage underrepresented communities and places, involve a wide range of people, nurture a future generation, and to listen to public concerns and aspirations. The people that we conduct knowledge exchange with are usually called stakeholders. These can be anyone who might be interested in, potentially benefit from, or be harmed by your research. The trick is to work out who the most important groups are to prioritise. What are the different methods that we can use? Science communication is primarily a one-way process, although there may be some limited opportunities for discussion. It aims to inform, infuse, and inspire. Science communication might involve disseminating the outcomes, outputs, and processes of research to raise awareness or promote understanding. It can also include activities which aim to inspire the next generation of scientists, or which aim to equip young people with the tools and knowledge to aid them in future debates around science and technology. Examples of science communication would include press releases, podcasts, public lectures, and web videos. Knowledge exchange and commercialization activities are used to develop collaborations and to enable the application and translation of the research into commercial outputs. These activities often involve partners across a range of different sectors. Public engagement involves specialists listening to, developing their understanding of, and interacting with non-specialists. We define it as the things that we do to connect, share, and involve potentially interested persons with our research. It involves activities that bring researchers and the public together. It is more than just meeting an audience and telling them about your research. Effective public engagement is about two-way communication with the researchers listening to and learning from the participants. Public engagement covers a wide range of activities, such as sharing our resources, involving the public in driving our research, widening participation, inspiring future generations, stimulating awareness, driving collaboration, or co-research involving stakeholders. A term you might come across is public engagement with science. I tend to break public engagement down into 3 versions, depending on the level of contribution from the public. Level 1 is to share information, usually at the end of the project, that informs and inspires, more in line with science communication outputs such as those in news articles. Level 2 is to consult members of the public before or during your research and to gather opinions and suggestions from them that could improve your work. Level 3 is where you actively involve members of the public in research collaboration, all the way from drafting grant proposals through carrying out projects to sharing your findings and reporting. Something I saw recently that I really liked was seeing these categories also called disseminate, discuss, and do. Occasionally, people also use the terms involve and empower as public engagement methods or levels. To involve people could include workshops, roundtables, group processes, agreements, or volunteering. And to empower your stakeholders means they will then act independently of the research institute. A few examples of the inform level include printed material, podcasts, electronic media, news releases, conferences, static exhibits and displays, presentations, and websites. Examples of the consult level include open houses, public meetings, telephone surveys, questionnaires, hotlines, presentations, emails, written submissions, small group meetings, community fairs, expert panels, focus groups, interviews, or even prototype testing. Examples of the involved level include workshops, roundtables, and small group processes. Examples of collaboration might include consensus building, an advisory committee, a task force, a study group, conflict resolution, or people exchange. Another term that you might hear is patient and public involvement. It's most commonly used during clinical trials and observational studies. It involves actively working in partnership with potential research users to plan, manage, design, and carry out the research. It is research being carried out with members of the public rather than to, about, or for them. So how do you choose which type of activity? Think about, would the public input define or influence your outcomes? If not, you can go with inform. If they would, how much influence will the public have? If low, consult them. And if high, collaborate with them to get the best impact. We all need a little bit of help sometimes. This knowledge exchange planning tool is available on the QIB Impact Toolkit on the intranet, and it covers everything from identifying who your stakeholders are, what activity you're going to undertake, why you're going to do it, and what your goals are, as well as how you're going to track and report the outcomes. The National Institute of Health Research created this lovely illustration for a 5-step guide to involving the public in communicating your research. Starts with scoping, looking at what people are saying and the underlying assumptions. Then involving people, working out the significance for different groups and how to involve them. Followed by planning, propose content and formats that are relevant for the people accessing it. Then user testing, where you develop your material together. Followed by dissemination, where you continue to engage people and use their feedback. Here's a few things to think about. When there are many groups involved in an activity, plan ahead to make sure you know who's responsible for what and don't presume. Make your event as inclusive and accessible as possible. Involve your stakeholders as early as you can and create a coordinated approach. Be transparent and accountable for your work. If you don't know the answer to a question, just be open and honest about it. Think about your timing. Is this the right time to be discussing this topic? Always remember, mutual respect and trust is paramount, and never be afraid to strive for a better result next time. It's vital that you're able to show the value of any activities that you actually undertake. So how can you record changes in perception, debate, discussion, and observations? Well, here's a few ideas. The best evidence that you can get to show the value of your knowledge exchange activities is quantitative data, published information, trial reports, finances, citations, or acknowledgements. If you can't obtain quantitative data, you can rely on qualitative information, such as interviews, questionnaires, creative outputs, observations, focus group reports, response and feedback, online comments and discussion, or case studies. If you can't supply qualitative data, you can use secondary information to support your pathway to impact. Examples would include national or local trends, government policy that you can identify with, research from other organisations, reports from charities or NGOs, or even logic models. And now I'm going to show you 3 case studies. Professor Simon Carding organised a series of patient dialogues held at local GP surgeries and at the Quadram Institute itself. These events involved discussion, presentations, and questions from the patients involved. At the Quadram Institute event, it was possible to observe an increase in knowledge among the participants, as well as an increase in trust and understanding. And we were able to quantify the fact that most of the participants were more willing to volunteer for a clinical trial or observational study after the event. Our second example is an outreach activity developed by Professor Lindsay Hall. The interactive exhibit, Guardians of the Gut, was a giant walk-through cross-section of the human intestine. The physical exhibit took several years to fully develop, and it appeared at several scientific exhibitions, including the Norwich Science Festival. The exhibit proved immensely popular, and she even won an award for public engagement from the University of East Anglia. Teachers can now download the educational material associated with this activity from guardiansofthegut.org. Our third example is where researchers at the Quadram Institute met with members of the public one evening at a local shopping centre. The scientists explained their current research, and in turn the members of the public explained their concerns and topics of interest for the future. They tested out a 3 horizons approach, which allowed them to discuss both current problems and future needs. So the next time you have the opportunity to take part in a knowledge exchange activity, whether that's science communication, knowledge exchange and commercialization, or public engagement, I hope you'll do it. I'd just like to finish by saying a huge thank you for your time and attention.